Have you ever wanted to know more about egg freezing? When should I do it? What is the process? How much does it cost? What are the risks? If I freeze my eggs, does it guarantee that I could have a baby? So, egg freezing was initially offered to women of reproductive age who were diagnosed with cancer and about to undergo chemotherapy, radiotherapy, or surgery, which would likely prevent or reduce their fertility in the future. It was to give an opportunity to those women who would otherwise have no chance in the future to have a child with their own eggs, and therefore, even though it was labelled as experimental, it was widely seen as a worthwhile procedure for medical reasons. Since 2012, the experimental label for egg freezing was removed, which opened the doors for non-medical or social egg freezing. The number of women freezing eggs since then has been rapidly increasing as women see it as a form of family planning and deferring pregnancy for the future. Only 2 or 3 generations ago, women were mostly starting their families in their late teens or early 20s, at which point their fertility would be at its peak. However, in modern times, the age of first pregnancy has increased significantly, and even women in their 30s are considering postponing it nowadays. Egg freezing offers an opportunity to preserve some of this fertility for later years if she's not planning to get pregnant in the near future. Ideally, a woman should aim to freeze her eggs at the age of 35 or younger. It can still be done at older ages, but her chance with these eggs will decline. So what is the process? Basically, egg freezing is an IVF cycle that stops at egg collection by freezing the suitable eggs obtained. This means that you need to go to an IVF clinic, and there are things about this that you need to appreciate. Most women who freeze their eggs are single and hopeful to find a partner in the future to have a baby with. For those women who have a partner and are in a stable relationship but are not ready yet to have a child in the near future, they may be better off considering freezing embryos as they have a better success rate. Or even, she could decide to split half her eggs into embryos and then the other half freezing them just as eggs. The main idea with egg freezing is to try and promote as many eggs as possible to mature. To achieve this, the woman will need to take daily injections to stimulate the ovaries, and this will require close monitoring of the response by transvaginal ultrasound scans and blood tests frequently for about 2 weeks. The egg collection process will involve anesthetic sedation to make you sleep, and a long needle is passed through the vagina into the ovaries to aspirate the fluid which will hopefully contain the eggs. The eggs are then assessed, and any egg which is at the mature stage of development can be frozen for the future. Now let's look at the side effects and risks. With stimulation of the ovaries, it's common for women to experience abdominal tenderness and bloating as the ovaries grow bigger. There's also risk of something called ovarian hyperstimulation syndrome, OHSS, which is where there may be too strong a response to the medication, causing a reaction in the body that can result in fluid collecting in the tummy, fluid in the chest, and sometimes the woman might even need hospitalization. The risk of developing OHSS is determined by 2 factors: the responsiveness of the woman's ovaries and how closely the clinic has monitored and adjusted stimulation doses to keep her hormones well controlled. With the egg collection, there's also risk of bleeding, infection, injury to bowel, bladder, or blood vessels, and this is about 1 in 1,000 risk. Once you decide to use the frozen eggs and fertilize them with sperm, there is a specific procedure called ICSI that needs to be done. This will involve selecting the sperm under the microscope and injecting 1 sperm to each egg. Fertilization rate is typically around 70% of mature eggs, but in some cases it can be that none or very few will fertilize. In the UK, the typical cost for an egg freezing cycle will vary from clinic to clinic, and some patients will require more drugs which will increase the price, but typically it ranges from £4,500 to £8,500. Most women, up to 70%, who freeze their eggs at a younger age do not end up needing their eggs as they complete their family naturally. When it comes to the chance for these eggs to produce a baby in the future, it will be determined by 2 factors: the age at which these eggs were frozen and how many mature eggs were frozen. To give an example, at the age of 35 years, 10 mature eggs can give almost a 70% chance of having at least 1 live birth, whereas at the age of 42 years, 10 eggs will only give a 20% chance of having at least 1 live birth. You need to bear in mind that egg freezing is never a guarantee of having a baby in the future and should not be considered as an insurance policy. However, certainly freezing eggs at a younger age will leave you with more options at an older age when you may have too few eggs or they may no longer be of good quality. If you're interested and would like to discuss it further, please contact us for a consultation.